Okay, this discussion is going to focus on mechanical energy and manual therapy. So there are a lot of different types of manual therapies. We're primarily the mechanical energy and manual therapy that we're going to focus on for the purposes of this course. We're going to be focusing on just massage and both manual and mechanical spinal traction. That's kind of we are going to focus on. If time lends it to us, we can discuss some other forms in lab, but these are kind of the basic forms of mechanical energy and manual therapy that you'll be utilizing. So just looking at manual therapies in general, so the short-term and long-term effectiveness of most manual therapies is unknown. A big part of the benefit of manual therapies is just the power of touch and human interaction. So just the clinician being hands-on with the patient has a very positive effect. It tends to ease anxiety and foster confidence, promote compliance. A lot of these forms of therapy, it kind of, it makes the patient feel good about their interaction with their athletic trainer. And again, the psychological effective response is very good. The only tendency that you sometimes have is you need to be cautious of dependency that could sometimes build up. I mean, a lot of people like getting a massage or treatments of that matter. So sometimes they could kind of almost develop a little bit of a dependency on it. So again, just as a clinician, just know when any form of therapy, regardless of what it is, has kind of gotten to the point where the patient no longer needs it, and just kind of make sure that you kind of work with that plan. So massage is just a collection of different techniques, involving rubbing, kneading, and various other types of massage strokes developed in early cultures. Some of the possible benefits, muscle spasm relief, which can also enhance lymphatic drainage. Mechanical energy may help to stretch connective tissue, so you can get some increase in flexibility with some deep tissue massage, so we'll kind of talk about, and you'll get to practice the difference between like superficial gliding techniques and working on deep massage, and also increase capillary membrane permeability. So again, these are just some of the physiologic benefits that you can get with massage. Now, some other kind of things. So really, there's little impact on blood flow specifically. So in other words, they found that massage doesn't necessarily enhance blood flow to the area. Now, we had mentioned that it can increase capillary permeability, which is a circulatory effect. But as far as blood flow goes, there's no actual increase in blood flow. For light massage, the gate control theory explains the analgesic benefit. So a level 1 pain control can be achieved with some light massage, particularly like good superficial effleurage. There may be some stimulation to muscle repair. So there's, certain types of techniques that we're going to discuss that could help stimulate the repair process. Deep massage would have pain relief, but from a different mechanism. So obviously, when you start to go a little deeper with massage, the stroke gets a little bit more aggressive. You could start to enhance pain relief through level 2 or descending pain control. And usually sometimes that massage carries with it a certain degree of discomfort, but that could still kind of lead to some pain relief through that level 2 pain control. So again, review your different levels of pain control for that. And deep friction massage is proposed to increase. So a deep friction massage where you're going transverse to the tissue can both increase blood flow and disrupt adhesions. So that's a specific type of massage that we're going to talk about. So some other kind of massage misconceptions: there's no effect on muscular fatigue. Recovery is unaffected through the use of massage. Lactate is not removed, so you do not remove lactic acid via massage. Lactic acid gets removed through natural processes. Endorphin release is not promoted. So again, if endorphin release isn't promoted, you have to be looking at your other levels of pain control. So again, with the, kind of superficial, very light massage, you're looking at a level 1. And then, your deeper massage is you're going to be your level 2 or your descending. Arterial blood flow is not increased, muscle temperature is not increased. So basically, research has shown that it doesn't have these effects. However, again, there are, positive effects that we've discussed previously. So the massage techniques we're going to talk about. So if you look on here, you have various strokes and techniques that we're going to utilize. These first four, the Effleurage, Petrissage, Tappement, and Vibration, these types of massage typically all work together in what's called a general massage or a Hoffa massage. So these are all separate strokes that when somebody's getting a general massage that typically get used. These other techniques down here can be standalone or they can be worked in with a general massage as well. You have friction, bindage webs massage, and trigger point. And we'll talk about how those are actually performed. I have some pictures that you can look at, and I'll discuss kind of the characteristics of the individual strokes. So with Effleurage, so it's typically, if you're going to do, again, kind of that general or Hoffa massage, you will always begin and end with an Effleurage stroke, okay? It's basically a very superficial gliding motion. The idea is to go superficial, get the person to relax, create a sensory effect, so that would be your more superficial gliding. Eventually, you will start to work it a little deeper. Okay, so there is light and there is light, superficial, and and deep effleurage. But even the deep effleurage, you're still not really you're not being very aggressive with the tissue yet. The deeper pressure will start to stimulate the superficial blood flow and the lymphatic flow. Okay, in the skin. Okay, so you will get some of that in the skin and superficial layers. You want to try to direct the motion towards the heart if you can. Again, that's kind of replicating the natural return through the heart. And again, maintain skin contact as best you can with the return stroke. And again, the picture on the next slide will kind of show you this. And we'll get the opportunity in class to perform this on different body parts. Okay, so you see here basically an effleurage being performed on the back. Okay, now again, the one thing you'll kind of see, you'll kind of get used to different body parts and kind of how you're going to address this. But if you look here, you can see, so their initial stroke or their primary stroke is working towards the heart. That's what they're showing here. Here's the return stroke. So notice the hands. So on the return stroke, the hands are just lightly in contact. So the idea is the hands maintain contact with the body, but when you're on your return stroke, you're kind of letting up on the pressure and the amount of surface area that's getting contacted with the hands. So you can see here, the hands are kind of flat. This athletic trainer is kind of working up the back. On the return stroke, he kind of has his hands turned sideways and just lightly grazing the body part. Okay, so again, if you're doing a Hoffa massage, usually you'll start with Effleurage, you'll move to Petrissage. So what Petrissage is the really deep manipulation of the deeper muscle tissue. So you commonly gets described as lifting, pulling, squeezing, or wringing of that deeper tissue. The idea here is what you're really trying to do is you're trying to stretch the tissue, you're trying to mobilize the fascia, and you're trying to break up scar tissue. That's essentially what you're looking to do with this. This can be done with or without lubricant. Typically, Hoffa massages are usually carried out with lubricant. If you did want to do some deep Petrissage without it, it would be an option. But typically, to make it a little more comfortable for the patient, you will apply a lotion or a lubricant in order to because there'd be a tendency to sometimes pinch the skin a little bit, and that could get uncomfortable for the patient. So here is just again showing you some examples. So here's some Petrissage. Here you can see the athletic trainer lifting the tissue there. Here you can see using like a ringing technique. So basically the hands are just kind of alternating and going back and forth along the calf. So basically, if you could see this, like this hand would come down, this hand would go back, and they kind of work the technique in that fashion. Okay, tapament. So tapament would sometimes come next. This is just a repeated light striking of the skin. The idea here is that you're trying to this is primarily for sensory stimulation. Okay, so you're trying to desensitize nerve endings and again work on that relaxation effect. Okay, so here what you would see is you can see the different techniques here using the sides of the hands, just kind of repeatedly striking the area. Here he's kind of using like he's got his hands sort of cupped a little bit and they will just lightly strike the skin. Here's a situation where he's just kind of taking his fingers and lightly tapping her forehead. So those are all, and again, this is more for just sensory stimulation and relaxation. And then you have vibration. So what vibration is, again, this is again more for relaxation and sensory effects. What this is a repetitive movement of the soft tissue. So, in this case, another way we describe this could be like a shaking of the soft tissue. So here you see this individual's grasping the gastrocnemius here. What he basically do is grab it and just kind of move it gently back and forth with the hand. So again, it's a sensory. He's not picking it up or pulling at it. He's literally just kind of shifting it back and forth. So if you could picture just kind of reaching down, grabbing your calf muscle and just kind of shaking it to the right and to the left, that's basically what you'd be doing there. And there's various techniques. I'll show you some of these in class. Vibration sometimes is the hardest one to see when you're just kind of talking about lecture, but it's just basically repetitive movement of the tissue. So again, when you're talking about a Hoffa massage or a general massage, you'll usually include all of those strokes. The idea, though, is to begin and end with effleurage. Again, the duration is going to be based upon the body part and the effect that you're trying to utilize. Okay. So essentially, if you're just doing like one body part, you're looking at about a 5-minute treatment. For an entire limb, 15. Typically, clinically, in a clinic rehabilitation, there's not a lot of whole body massages, but just to keep in line with the principles of massage, if you were to do a whole body, it would be about 60 minutes typically. Again, clinically, we don't do a whole lot of whole body massage. We're usually just kind of focused on one body part when we're trying to utilize this. Contraindications to this type of massage: acute injuries unless it's edema massage. So if you have an acute injury, you're not going to kind of vigorously go at the area, but what you'd essentially do is do like a light, some people will do like a light edema massage. You see this very commonly with the ankle. Some people refer to it as a milking massage. It's essentially like a light effleurage. You're just trying to basically manipulate that fluid, help assist with manipulating that fluid out of there. The idea is that you kind of sort of manually push it out. Some individuals like to do that. I discussed that with the pitting edema with ultrasound. So some people like with the pitting edema, so someone gets some long-standing edema, kind of takes on that gelatinous kind of characteristic to it. You heat it with the ultrasound and then you kind of can manually push it out, or they could do active exercise and that would work as well. Over skin lesions or diseases, you obviously don't want to do that. Fractures, hypersensitivity, and infection would be other contraindications. Your indications for the Hoffa massage, the various strokes involved: pain relief. Again, think about the type of massage you're doing and the type of pain relief they would be experiencing. Decreased spasm and then increased venous return and lymphatic flow.